right. Autologous breast augmentation, go for it. A no. Demon, can you hear me? Yes. So we are live, and I'm going to answer all of your questions. Autologous breast augmentation is when you use fat. So if we take fat from somewhere and we transfer it to the breast or the buttocks, it can be a great option for breast augmentation. Now you got to have space to put the fat, and you have to have fat to take. So, but generally you get about a half cup size to a full cup size improvement when you do that. So it's great though, you don't need to use an implant and whatnot. So, all right everybody, we are going live here, and I'm here to answer your questions. It is a sunny day in Beverly Hills, like it is every day. It's a beautiful day to be alive. We actually just finished multiple surgeries today, so I'm going to call my patients in a minute and catch up with them to see how they're doing. We did a few breast augmentations. We did a couple local cases. I did a nipple reconstruction for someone who had breast cancer and a mastectomy. Let me get this microphone all the way out for you guys. So we did a lot of good stuff today. We also did a tummy tuck and liposuction. So if you tune in, make sure you tune into my Instagram and even my Snapchat. We're actually doing some stuff on Snapchat now, Barrett DM. We're actually going to show a little bit more on my Snapchat, so you can follow me on Snapchat as well. Barrett DM, B-A-R-R-E-T DM. You'll see some sneaky stuff in there. And then Tanya Hernandez, can the fat from a tummy tuck be used for buttock implants? Yes, you can, and I do that all the time. It is called a Grand Slam Mommy Makeover. We do the breast, we do the tummy, liposuction, and then we do the buttocks at the same time. So all three of those things. So the other thing we did we did a local case for breast reconstruction, and then we did a belly button revision, you guys. For whatever reason, everybody comes to see me for belly buttons because I'm just obsessed about belly buttons. You know, it is the dead giveaway if you are getting any type of abdominal procedure to make the whole abdominal silhouette look good. The belly button's got to look perfect. Okay, so do I have a PA on my team? I don't have a PA, but I have nurses, I have doctors, we have all kinds of people. So we're going to get into your questions, you guys. So these are some questions that you guys wrote in. So let me get through these first, and then I'll get to these other ones here. Okay, so these are really good questions. This one's from H. Keeney 87. Is it risky to have lipo of the abdomen with a tummy tuck? It is, but you have to understand that you can do a certain amount of liposuction safely with a tummy tuck, and it makes sense. Okay. Now the reason why people worry about liposuction and a tummy tuck at the same time is because it can disrupt the blood supply to your incision. Remember, if we make a cut here, we're cutting off half the blood supply to the skin. Okay. So if you do liposuction above, you're now potentially damaging those blood vessels. So if you keep your liposuction up high in certain discrete areas, or very gentle amount of liposuction, or on the flanks where there's no incision, it's safe. But sometimes if you're too aggressive with the liposuction, you can actually cause skin necrosis along your incision. That's why people tend to not do it, or they just do a very gentle amount, which is what I do, because if done in the right amount and the right areas, liposuction with an abdominoplasty is safe, which is also a tummy tuck, okay? So another question from Hannah Romano, do you ever regret going to medical school? That's a deep question. I don't. I love what I do. I had a tough time with residency because it was a surgical residency, and I don't think surgical residents are treated fairly, and I think they're underpaid. I hope that's something that changes, because literally, you know, you're getting starvation wages for the amount of hours you work. Unless you're independently wealthy, you're going to really struggle. And I really struggled because, you know, I came from a blue-collar family. We didn't have any money. I had no money, going through residency with tons of debt by the time I got to residency, and then they pay you $37,000 a year to work 100 hours a week. It's kind of stupid. And so that part, I think, needs to change. For Nujan, how do you know what implant size will give you the desired cup size? You really don't. I don't use cup size when I do breast surgery. I focus on the overall look and the appearance. I take the whole body in consideration. So I do on-table sizing with implants. I don't really focus on cup size because cup size is different. If you go to Victoria's Secret, you could be a C. If you go to Neiman Marcus or Saks, it could be a B. So, you know, it all depends on where you go for the bra sizing. Okay, we've got 4 more questions, actually a few more, and then we're going to get into some of your questions. Can you achieve a teardrop? This is from Shannon Dane. Can you achieve a teardrop breast shape from someone starting with tubular breasts? Yes, you can. It takes time though. So you have to do a release, you have to put the implant in, and you have to give it many years for that to kind of drop and settle over a fold. Okay, normal breasts, when they grow, they have many years to kind of grow like that. Tubular breasts are very tight, they're constricted. You have to expand them, put an implant in to hold that open, to pop it open, and keep it open. Okay, so yes, that is possible, Shannon. Shannon's got another question. What are the pros and cons of underneath the incision versus the one you do at the nipple? That's a great question. So a lot of you guys know I do a periareolar incision versus an inframammary incision in the majority of my cases. And the only reason I do that is because I recommend it and my patients, go with what I recommend. When I first started my practice, I did nothing but inframammary, and I found that the scarring is horrible. You have a higher rate of bottoming out of the implant, and there was a much more noticeable scar. I mean, imagine if you took a big marker and put it across the tile floor, you would see it. And instead, if you go with the border of the areola, it's much more concealable. It can be hidden, like you take the marker, you put it in the grout line. You're not going to see that, right? Not only that, but there's no difference in nipple sensitivity, breastfeeding ability, and capsular contracture rate in my hands. Now, previous studies over 20 years ago showed that the capsular contracture rate was higher for the periareolar incision. But my capsular contracture rate is now less. It's 1 in 100 versus nationwide, it's 1 in 20. So with doing the Keller funnel technique, all the 14 different steps I still do a periareolar incision, and I don't get very many capsular contracture, and people get the scar that they want. And that's, to me, very important, because who wants a big scar and who wants bottoming out? That doesn't happen all the time. A lot of surgeons do great work with inframammary, don't get me wrong, but if you ask me, all the ones that I used to do with inframammary and the ones I do now periareolar is way better. It is harder to do, it is a longer technique. That's why a lot of surgeons like the inframammary. They can get in faster, but my goal is to give you the best results possible. Okay. Lily Mita, fish oil is better than Singulair to prevent capsular contracture. No, it's not. We don't have a study on head-to-head comparison of fish oil versus Singulair. So guys know capsular contracture is the #1 complication for breast augmentation surgery. Anytime you put an implant in, you get the scar tissue that can kind of develop. We think it's due to contamination or so forth, and there's a medication called Singulair, which is an allergy medication, which helps prevent that from happening. I don't prescribe that for all my breast augmentation surgeries because it can cause nightmares and some other things. It's a medication. I do prescribe it if you start to get symptoms of tightness and so forth. What I do recommend to take right after any breast augmentation patient surgery is fish oil. Fish oil has been shown to reduce capsular contracture by 10%. And it's good for you. And you live longer. Okay, the important thing is to make sure you get a really high quality fish oil to do that. So a lot of people use these crappy fish oils, already rancid. It actually makes your body feel worse. So the fish oil that I recommend is on my website, postoprecovery.com. I don't make any money off of it. It's just what I found to be the best non-rancid fish oil that you can get. It's Living Fuel Omegas. And again, it's on my website, postoprecovery.com. Make sure you check that out. And that will help prevent your capsular contracture by 10% according to one study, all right? And if not, it doesn't hurt you. I do have you wait a week after the augmentation so that you don't get any increased risk of bleeding, okay? Love Raisin, R-A-Z-O-N, Love Raisin, love it. Can Botox help with post-stroke droopy eye or scar on the nose? I don't think Botox helps with scars. It can help with a droopy eye after a stroke, but you would have to do it on the regular eye. My recommendation is to see a doc to kind of see what you can do. You can actually put weights in the eye and so forth. You have to really kind of see what's going on. All right, I'm gonna pop on Jessica Grant. Question, I hate my keloids from laser lipo, post of 1 year. What do you suggest? Jessica, cut them out, redo them. A lot of times when you do liposuction, if they're not using a port, which I do to protect the incision, you're gonna get little traction injuries from the cannulas going in and out. So my strong suggestion is just come in, we'll cut it out, close it up, start fresh, do your scar management protocol afterwards. And if we have to later, do a laser, okay? But if they're already bad to begin with, cut them out, let's start over. We'll get it right from the beginning, okay? All right, I got another question here. This is from 0411. Why use textured implants? You know, that's another good question. There's different types of implants. There's smooth, there is textured. Okay, I used to use these more for, you're welcome, Jessica. I used to use these more for revision work because its texture kind of holds everything together. It's a simplistic way of looking at it. Smooth implants, they tend to slide around a little bit more, but they tend to feel more natural. So what they found is that textured implants have a slight risk of what's called anaplastic large cell lymphoma. Allergan textured implants had a 1 in 3,000 chance. That's high. all right, of getting lymphoma. Nobody wants that. Mentor is about 1 in 50,000, okay? It's a different type of texturing process. So I still reserve the use of these for people that have a recurrent capsular contracture and nothing else seems to work, and they're okay with a 1 in 50,000 chance of getting that lymphoma. If not, I use pretty much smooth for everything else. So pretty much a rare kind of set of circumstances to use textured anymore. And I'm fully educate my patients to make sure they're aware of the risk of that lymphoma, which is really pretty rare. Again, you're more likely to be struck by lightning in your lifetime. Just FYI, 1 in 10,000 chance of you getting struck by lightning in your lifetime. This is 1 in 50,000 chance of getting a lymphoma, but still a lot of people don't like that and they just assume that's going to happen to them. All right, got another question. We're almost through these prefab questions. Let's see, one more set. Favorite scar treatment for tummy tuck? Well, you know, it all starts with the closure. 4-layer closure, taping for 6 weeks, Scanuva scar gel afterwards, skin scar tapes if you need to, and then I do a CO2 laser that just blends it all away. Okay, like pokes little holes and it blends in all the collagen. Okay. Jessica Arciero 1, I'm 5'2" and 140 pounds. What will be the proper size for breast augmentation? Jessica, that totally depends. Bra sizing depends on what your goals are, or implant size for breast augmentation. But implant size depends on your current bra size, what your goals are, and your measurements, which we can figure out with a virtual consultation or coming into the office. Okay, if you want a virtual consultation, check out our website, drdanielbarrett.com. Go to virtual consultations. You can fill out your information and we'll get back to you. Okay. Again, Dr. Daniel Barrett, virtual consultations on my website. Website is drdanielbarrett.com. Dr. Daniel Barrett. All right, I have fatty liver. Can I still get a mommy makeover, or is it too dangerous? Yeah, we got to figure out why you have fatty liver. All right, are you overweight? Are you obese? You know, so blood clots are a real thing. So I think you need to pay attention to your health prior to getting surgery. Getting surgery puts you at higher risk for blood clots, especially a mommy makeover, okay? So we need to kind of look at your health history to see what would work. Will insurance cover breast augmentation? Typically not. Zoe Diana, that is typically a cosmetic only thing. The only reason it would cover it is if you had born with completely no breast on one side. And that's called Poland syndrome, and then they would cover that in that situation. Okay, so let's dive into some questions. Tina Bellina, is it possible to exercise to get abs after C-section? Yes. After C-section, Tina Bellina, yes. I recommend people to exercise after in the postpartum period. Okay. A lot of people say don't exercise. It's going to make your rectus diastasis worse. According to what study? Who says that? Right? Get out there, do what feels good, exercise your body, movement. Okay. You want to bring those muscles back together before they kind of settle in. Right? There's a lot of stickiness and scar tissue that happens after pregnancy. Your muscles widen. And you want to bring them back in together with some good core workouts. It doesn't hurt, okay? All right, here's another question from Shan55. What's the difference between rapid recovery breast augmentation versus regular? Shannon, good to see you again. Yes, so there's a lot of things that you can do. A simple breast augmentation, you go in, you cut, you open, you put the implant in. Okay, you blunt, dissect, you do all kinds of crazy stuff. It's very painful. That's why people traditionally have 2 weeks recovery for breast augmentation. Now, what we found is if you pre-inject the breast with numbing medicine, you do a whole block all the way around, you dissect with cautery, and you do minimal dissection and gentle relaxation techniques so you're not traumatizing the area very much, the whole breast doesn't create an inflammatory state. Okay, yes, your brain is out from anesthesia, but if you don't numb up the area, your spinal cord feels it, and you get what's called upregulation of pain. So if you ever gotten a splinter in your finger, you would notice that you would get like it doesn't hurt right away, but then 2-3 days later it starts to hurt. Same thing happens to your body if you go through a whole operation without numbing medicine on board. Okay, anesthesiologists are actually the ones that actually taught us about that, and if you actually listen to them, they know about pain and how to reduce it. So yeah, you don't feel it because your brain is out, but your body feels it. So we incorporate multiple times a way where we inject. We put it in the pocket after we're done, and then we use a Keller funnel. We don't use very traumatic techniques to get the implant in, and then we close it up beautifully. That's the kind of key to some of our rapid recovery techniques. The other things we do are supplement based, getting you off pain medication, restoring your gut after your surgery so that you don't have a whole lot of inflammation, you have regular bowel movements again, you can eat again. All those things contribute to your rapid recovery. Like most of my breast augmentations, they're back to work in 5 days. 5 days. All right, tummy tuck, 10 days. Okay, so that's just what you get for being meticulous and following the evidence. and taking care of your patients. Can you get Botox if you're 23 years old? Certainly can. A lot of people can have early signs here or early, RBF. Text me if you know what that means, RBF, okay? You get those little lines right here. I actually, first time I got Botox, I was on residency and I was just going around mad all the time because I was like, why are you working so hard? And so I Botoxed right here just so I go around and look happy all the time. I say, hey guys, I'm sleep deprived, but I'm okay. Anyway, so yes, you can. So 519BFI, is it possible to still get plastic surgery with heart problems? Totally depends on the heart problems, how long they've been. Sometimes it's very dangerous to get plastic surgery if you have a recent heart attack. Generally, we want to make sure you get cardiology clearance if that's the case. I have a ruptured implant. Doc said he's going to replace both implants. Maria, that makes sense. If one is ruptured, the other one might be close to being ruptured, might as well just swap them both out, right? It's like when you, so you go to the car dealership to get your tires, one tire replaced, or are you just going to get them all replaced, right? So I always do car analogies. It's never really elegant, but I think it gets a message across. Maybe it's just because I'm a guy. Does Juvederm transfer and move? Yes, it can. That's why you want to make sure you're careful and you don't go high up on the lip especially. Who's a good candidate for a lollipop lift versus anchor, Gia? Everyone. Everyone is a candidate for a lollipop. There is no reason to do an anchor scar anymore. The only reason the anchor scar is done is because surgeons don't know how to do anything other than the anchor scar. Okay, you guys know about this, right? Breast lift, incision around the areola, line going down, that's a lollipop. Imagine just like a lollipop, right? The anchor pattern is so prevalent because surgeons are stuck in these old school ways, but it's not good. It creates a flat and boxy appearance of the breast and creates additional scar tissue in this horizontal fashion. It looks good on paper. Surgeons like to set that inframammary fold, but the breast is a three-dimensional structure and it never looks that great, okay? So my recommendation is go to a surgeon that uses a lollipop incision, like myself, okay? Do you have to stop smoking before your surgery? Josie, yes, hell you do. Smoking is really bad. It prevents healing. Most of the time I don't operate on smokers just because you're gonna have wound problems. And I do your surgery, you don't stop smoking, you have a wound problem, you're like, doctor, why'd you do this to me? I'm like, I didn't do this to you. You did it to yourself because you were smoking, and I just don't even go down that road anymore. So yes, stop smoking. You'll live a lot longer. Yeah, a lot of people die from lung cancer. It's no good. Let's see. All right. So what procedure do you do after keloid removal? So the keloid removal, let's go back. So keloid is a hypergrowth of scar tissue. A lot of times you can do Kenalog injections, which is a steroid injection, or sometimes you can get radiation of the area so that the keloid doesn't come back. You haven't smoked in 5 years, Maria? Hell yeah, nice work. No reason to. It's expensive, it's ugly, it stinks, and it's not good for you. When do you do a thread lift versus a facelift? Ali, 5:30. We do thread lifts in the office. I'm not a huge fan of them. They work. They give you a nice 6-month, 12-month result. I like to put my hands into things that are more permanent. So I like facelifts, all right? So that's the main difference. Thread lift is kind of expensive because you're using very expensive products. It's taking a long time. There are complications associated with it, and it doesn't last forever. And it doesn't give you the most amount of control either. I have a lot more control on a facelift than I do with threads, but you can do it on your lunch break, right? So that's great. Just so you guys know, I have an Instagram page. I got surgeries. I just did a couple surgeries today, live surgeries, drdanielbarrett.com. Make sure to go over and follow that. And then also, if you're on my Instagram, you check out my TikTok at Barrett Plastic Surgery. I've got some cool stuff on that as well. Do I do oblique plication, Victor? Typically not. Obliques, that's the muscles on the sides here. I don't typically do oblique plication unless there's a lot of laxity. I typically do a midline plication. I bring it in, and in case you guys understand, so a tummy tuck is, yes, we remove that extra skin and fat, but the plication, we actually bring the muscles back together. Typically, if you have weight loss or if you have pregnancy, your muscles are widened, and that plication brings it back together. Okay, so I typically only do a midline plication, and it does a couple things. It strengthens your core, cinches in your waist, and it makes it flat in the front. Okay, all right, so how much does too much Botox in the jaw for TMJ make you age faster? Whereas, no, I don't think so. They actually done studies on, thanks for the sunglasses. They did studies on Botox and people's skin. And there's an independent, besides relaxing muscles of dynamic, wrinkles of dynamic action, right? So like here, and to prevent those wrinkles. It actually improves the collagen in your skin whenever you get Botox. It's an independent thing that happens. Okay, so I highly recommend Botox for preventative and age, and beautification. It's great. Have I ever had surgery done on you? If so, what? Yeah, I had a septoplasty inside my nose, or I had a deviated septum. I grew up in Virginia. I couldn't breathe out of my right side of my nose my whole life growing up. Now I can. It's not perfect, but it's better. And I had gynecomastia surgery. I had left chest growth. So I helped actually design a surgery to do that all endoscopically now. So you don't have to have a scar like I have. So if you're one of those guys out there that has male breast growth, come see me. I do a technique. There's another group in Dallas that does it as well, where you can kind of core out the tissue and flatten out the chest. And then what else? I had appendicitis. Okay, they took out my appendix laparoscopically. It's kind of a funny story. When I was in grad school. I felt really sick, and there was this formal dance coming up. My girlfriend at the time, she was so mad at me. She's like, "Why are you sick? All your friends are like, can't believe it, you're so sick." I was like, "I can't do it." And like, they're just like, "Have a drink." I'm like, I had a drink. I felt awful. I went home, and she's like, she goes to the dance without me. She was my date to this formal, and like the next day I go to the hospital and I have appendicitis, and she like felt so bad. But anyway, needless to say, we're not dating anymore, and now I'm married with my wife and kids. But that was a funny story about my appendicitis. What other surgeries have I had? I think that's it. Yeah. Everything. Yes, I'm 5 weeks old. You should have been sent there, in the first place. Yeah, I know. Used to work in plastics. Loved it. That nurse, Danny. Thank you so much. All right, let's get a couple more questions in. Can you get a breast lift without a scar? Nazira, yes, you can. You can get a minimal breast lift with Renuvion. It's a J plasma. It goes in and tightens up the breast tissue, but it's a very minimal lift. But yes, it can be done. You can also do some liposuction associated with that. You want to know about my wife? That'll be for another live. Okay, we're answering before and after questions. What's my favorite implant size? I think 325. If you look at all of the implants that I use, and trust me, I use a lot of them, the most common size that I'm using, based on the numbers, is 325 cc's. When do you recommend a mid-face lift? I don't. I never recommend a mid-face lift. I used to do them. They cause a lot of problems with extropion, right? The eyelid can go like this. It's better just to do a facelift. It's better to do minimally invasive fat grafting and CO2 laser. There is no indication anymore, in my honest, humble opinion, to get a mid-face lift. It is fraught with difficulties and complications. Stay away from it. Get a facelift instead, get threads, whatever else. Nyla Marie, thank you. All right, so I had 2 C-sections. Is it possible to get my tiny, get back to the original shape? Fairuz, Sultan, yes, it is. Just depends on how determined you are and if you need any surgery. I'm here to help you. Will I come to the UK? That's tough. I'd love to go to the UK. I'm going to Europe this summer. I'm going to go to Switzerland. I'm going to go to Italy, and I'm going to go to Malta. Have you guys ever heard of Malta? I have a half-sister who lives there. I never met before. She was kidnapped from my mother's first marriage when she was 3 years old. Can you believe that? And I'm going to go meet her for the first time. She's 50 years old now, so how's that for a crazy story? You got to stay tuned to my Instagram. I'll post you all that stuff when I get to go meet her. You guys are welcome. Where's my office? I'm in Beverly Hills. Yes, I'm excited for Malta. You guys, we're gonna bring the whole family out there, meet her family and everything else. But then maybe a London trip. I haven't really done due diligence to England and Scotland and all those other places. So I think I spent a couple nights there one time back when I was in med school. But we're gonna hit it up big time at another time. And I'm a high school interested in plastic surgery as a career for extra. Yeah. He 1X. Yeah, plastic surgery is cool. It's a long road. You got to go through medical school. You got to go through residency. And it's all very competitive. It is the most competitive residency to get into. So first of all, to get into medical school is tough. Once you get there, you got to get into, it's really, really tough. My board scores. How was she kidnapped? 77. I'll leave that for another story. Okay. What's the best fillers? Fillers can be varied for all kinds of reasons. There's hyaluronic acid-based filler. There is Radiesse, which is calcium hydroxyapatite. I use that for like cheeks and mid-face. But then there's thinner fillers that are hyaluronic acid based that are better for like nasolabial lines, under the eyes, and so forth. Okay. That is it, you guys. We're done with this live. It is Wednesday. Got another surgery for you guys tomorrow. I am on this weekend. I'll be in Salt Lake City. So any of you guys in Salt Lake City, I will be there for my brother-in-law's wedding. Which would be cool. So you guys wish me luck on that. He converted to Mormonism, but he's marrying a woman from Uzbekistan who's not Mormon. So this fun stuff in my family, and we'll keep it going. He's got to wear a golden suit as part of their culture, so I think that's pretty cool. But I'll follow me on my Instagram, Dr. Daniel Barrett, and I will get I'll make sure to keep you posted on some of that fun stuff. All right, thanks guys. I'm gonna go out.